from the Congressional Budget Office that the Senate's secret backroom deal to repeal health care will cost 22 million Americans their coverage proves one thing. Republicans are only interested in providing huge tax breaks to the wealthy, not in protecting our health. Good morning. I'm Ed James, and this is Black Almanac. Trump Care will give nearly $70 billion to big corporations and the wealthy. The reality is that the elderly, working poor, and communities of color will be particularly hard hit. In addition, Trump Care will be an assault on women, those living in rural communities, and the urban working poor by preventing Planned Parenthood from receiving federal funding and forcing women to once again pay more for their health care. Joining today's discourse with insight and analysis, Dr. Washington Hill, an OB/GYN and maternal fetal medicine specialist, practicing at Sarasota Memorial Hospital and Florida Department of Health, and political analyst, Dr. Lawrence Miller. Well, I have my two favorite doctors with me today. My medical doctor for my wife, and my favorite doctor of politics.
Well, thank you.
I needed two.
Okay.
You know, Dr. Miller, you and I have been handling this pretty good.
Yes.
But now we're back to killing Obamacare again.
Yes.
Yeah. Dr. Hill, what would, from your perspective as a physician, what happens if you just kill the current Obamacare?
We would go back to where we were before Obamacare. And one of the worst parts of that was that the patients who needed health care access did not have it until they were sick. And therefore, they would go into the emergency room, and we all remember those days, and they would be very sick. Some would die because they had delayed care because they didn't have any type of insurance. And for example, also they would be pregnant and they would not have insurance because their insurance company would not include maternity as a part of their coverage. So they would have to get a rider, which was expensive if they could get it, or they would come in labor.
You know, you mentioned their insurance company wouldn't, certain things would not be a part of their coverage. Wasn't that one of the very positives of Obamacare, like full coverage for everyone, and rather than, but we are hearing that with the Republicans' proposed bill, every American could get just what they want.
One of the best parts of Obamacare was that in that act, there were very specific things that insurance companies have to cover. Behavioral health, maternity care, family planning. So if we were to repeal all of Obamacare, then those things would not be possible. And an insurance company could say, as they had in the past, Mrs. Jones, you have insurance, but it does not cover maternity care.
You know, the other part of this, in terms of the Affordable Care Act, is that it changed the dynamic revolving around, as Dr. Hill was mentioning, how it was before, in the sense of accessibility and affordability. As soon as the CBO came out with a score that 22 million people were going to lose health insurance coverage, okay, that seemed to turn the tide for a number of different Republican senators as it related to the Senate bill that was before them in terms of how they met in secret and then brought this out, and people were analyzing it, reviewed it, and were sitting on the fence. That changed everything. So I have to give a certain amount of credit to the CBO as a nonpartisan reviewer of bills that come before the United States Congress. Because without that bureaucracy, without that nonpartisan look at it, these people would have gone ahead and passed this bill, maybe with a few sweeteners here and there for them to, move closer towards it in terms of feeling comfortable with it, but which may happen eventually anyway. But without that CBO score, these people would have been able to pass this thing basically in secret without anybody having any idea basically what's in the bill in terms of the American public.
And 17 million by 2018 would lose their Medicaid coverage. 17 million. And by this time next year.
That's a part of this secret plan, the Senate's plan. You stretch it out, all of your dirt, to get past 2018 midterm elections, to get past 2020 presidential election.
Yes.
And then if the public doesn't know, they don't get upset.
Right.
And they get put right back in office again.
Exactly.
Good point.
No question. And the fact of the matter is that as far as the plan is concerned, when you have Susan Collins, who's supposed to be a moderate, she's the senator from Maine, and then you have Rand Paul, which is on the other side of the spectrum in terms of being a conservative, both being supposedly against this particular bill, her after the fact, after the CBO score, and him before, you have a situation where you could tell that all the grief that they gave President Obama was solely for political purposes. It had nothing to do really with health care, because they were not prepared once he left office to come up with a plan that had any real substance to it that would address the problem, again, of accessibility and affordability. They're always talking about premiums going up, and this bill really doesn't do anything revolving around that.
Well, they had 7 years.
I was going to say.
7 years.
Yes.
So either Obama is brilliant or the Republican Party is stupid.
Take your pick.
Now I ask the audience, what do you believe? Dr. Hill, you mentioned emergency rooms being the doctor of choice when you don't have insurance.
That's the way it was.
Well,
and it could go back to that.
But in rural America, there may not be any more emergency rooms. Can you talk to that a bit?
Well, as the viewers know, the emergency room is sort of the entrance into the healthcare system when I'm sick and I don't have insurance or I'm poor. So that in those places that don't have, I think most hospitals have an emergency department, but in areas where it's small, then patients going to have to be seen there.
But since 2010, we've lost one rural hospital a month.
Correct.
No longer a hospital. Now, in many of these places out in the Midwest, in the Rust Belt, and like to say, Middle America, they won't have who voted in big numbers for President Trump. They're going to lose, those that haven't lost their hospitals are going to lose them.
Some of them are going to lose their hospital.
Yeah, some of them right here in the state of Florida. I used to work as the city manager for the city of Arcadia. They had in DeSoto County, DeSoto Memorial Hospital. That hospital was having financial problems because of indigent care.
Right.
They could not go ahead and take care of people, as Dr. Hill was mentioning, as far as poor who are not able to go ahead and pay.
And so If that was the so-called good times,
Yeah.
they couldn't do it.
Right, and those
Where would this
patients,
leave us?
those patients in an area where the hospital is small or it doesn't exist, has to go to or be transported to another hospital.
Let's talk about a heart attack or a stroke.
All right.
What does time mean if you got to be transported and get somebody to get you there?
Heart attack is very important. There are now protocols that should be instituted very quickly. So if you live out in a rural area, you may find by the time you get to the city or a tertiary center, a big hospital, that it's too late. The same thing is true in maternity care. If we have a patient who's bleeding here in Sarasota who's pregnant, she's in the hospital in a very short period of time. She's bleeding out in DeSoto or Wauchula and is having a significant problem, even in the hospital, and needs to be transported, it may be too late.
How do we get local communities to understand, and I don't want to be accused of organizing protests, but how do we get them to understand that this could be your death warrant?
Well, you know, a number of people, you have these groups like Indivisible that are out there. A number of people throughout the country have gone ahead and protested already in terms of once they found out about the Senate bill. They sat in Mitch McConnell's office, right. And a number of different other senators. So you have people out there who are cognizant of what's going on and are taking action revolving around what's being contemplated by the Senate. Now, let me also say this. The Republicans may be saying what they're saying as far as the bill is concerned, that they're pushing, but I think the Democrats have a responsibility also. And I heard what Senator Elizabeth Warren had to say about the Democratic position. The Democratic position, from her perspective, was that they should be pushing single payer. In other words, Medicare for everyone, all right? So that we look at this issue of whether someone gets health care based upon the fact that it's a right and not a privilege. I was speaking earlier with Dr. Hill as it pertains to life expectancy. A number of countries like Germany, Canada, France, all have universal health care and have a longer life expectancy rate than the United States. The United States is 42nd. We talked about infant mortality, which I'm
maternal
sure
mortality.
Yeah.
Maternal mortality, neonatal mortality, mortality of elderly folks depends on appropriate and adequate access to health care. The health care has to be good. Bad health care isn't good. And access to that care. And in the future, my niece is at the house today, in the future she could live to be 100. Some of that has to be because she's going to be receiving good health care. She's going to have access to it, and she's going to receive it. In countries that don't have that, such as ours, we find that our maternal mortality is increased, and that's a real issue for this country.
There was a big deal about America's exceptionalism. President Obama didn't appreciate America's exceptionalism. Why is it then, of all the industrialized countries, America is the only one that doesn't have health care for all?
For all, universal health care. Yeah, and you pick up on a very good point in terms of President Obama bringing that out, because the debate had been during that time revolving around, if you remember, a public option, because he didn't feel he could get some of his people, even in the Democratic Party, to go along with Medicare for everyone. Okay? So this is a very hard issue for the American people to go ahead and make a choice revolving around. Because if you have a situation where you are in a DeSoto County, or even if you're in Sarasota County or Manatee County, and time is of the essence in terms of whether you're a child or whether your loved one
Or you.
are going to survive, okay? When you make that choice in terms of going into that voting booth and vote for somebody, that has a rippling effect upon whether your, as we are saying, loved ones are going to be able to make it, especially when you have legislation like this that is coming forward.
Your decision in that voting booth is complex. There's many, many issues, and you two talk about them all the time. But one has to be health care. Because we all, at some point, are going to need health care. And if you don't have access to good health care, I think it's fair to say that's going to shorten your life. And affordable health care.
Exactly.
Affordable health care.
Right, those things go hand in hand, and that's where the debate has changed, because all too often we have looked at health care based upon whether someone has a job. I think it was Kellyanne Conway talked about, well, if you can't get Medicaid, go get yourself a job, right?
Okay. If you're sick, how can you work?
Yeah, exactly. It doesn't make much sense. But the fact of the matter, and we had another, now this really blew my mind, a few years back when Harry Reid was running, a Tea Party candidate for the Republican Party was talking about how you could barter with chickens back in the day.
I wasn't practicing at that time. No one brought me chickens for a delivery, but we can't do that now. The doctor has to pay his staff. The hospital has to pay their workers. And
you pick up a good point, because no matter what, whether you have Obamacare or you go back to the old system, somebody has to pay.
No question.
This House struggled and got their bill passed after being rejected first time by 2 votes. So the Senate, being smart, the smart ones, they go behind closed doors, don't tell anybody what they're doing. They don't tell the Republicans, the Democrats, or anybody.
Right.
Then they come out with this bill. And then they find that their membership, initially there were 2 people, 2 Republican senators, Senator Collins and Senator from Nevada.
Oh, from Nevada, that's Dean Heller.
Dean Heller were against it.
Right.
And then they picked up 3 others when they saw it.
Yes.
And then that gang of ultra-wing, Cruz and
Rand Paul, and Lee, Mike Lee.
And as of this point, there are 12 to 14 Republicans who are saying no.
Right.
And now they are home for the holidays.
Exactly. And you know, the thing here is that what they're cooking up for us, they don't eat themselves. You know, the meal that they're preparing in terms of health care is something that they're giving to other people. Most people don't realize, because if you ask them out on the street, you know, well, your senator, does that senator relate to you? Most of those people are millionaires. Most of those people are lawyers, okay? So you may have a doctor among 1 or 2 of them.
There's 1 or 2 there.
Yeah. And as far as that is concerned, it doesn't make them, with all due respect, doesn't make them in terms of geniuses when it comes to putting together a healthcare system.
Well, the president said that the reason his cabinet is full of millionaires because poor people don't know what to do. He doesn't want poor people in his cabinet.
Exactly.
Now, this is the man you vote for. He's telling you in every way. And you remember what they said, when a person tells you who they are,
believe it.
Believe it. And he's told us
in so many ways.
In so many ways. And he continues to tell us. But we continue to believe that Well, he has a lot of money, so he's all right. Now, every day we're beginning to see, to a great degree, how that money came about.
Exactly.
And everyday working people go to jail for the way he got his money.
You have health administrators, you have scholars, you have different people. You need people at the table all together. The practitioners, the patients, everybody at the table.
And that didn't happen.
No.
From the healthcare industry, how many folk do you, these organizations are opposed to this bill?
That was one of the notes that I made, all of them. I'm an OBGYN, the American College of Obstetrics and Gynecology is against it, the AMA, the Internal Medicine Societies, the Osteopathic Societies, all of the societies are against this bill. I could not find one that was for it. And it's because of the Medicaid cuts, the opioid problems, which are not addressed, etc. So all of them.
Now, what happens to people who have existing health issues with the new bill, with the proposed Senate bill?
The insurance company can opt out of taking care of them.
Exactly.
With the ACA, there wasn't any opting out. There were essential, we mentioned it earlier, there were essential disorders that had to be covered by their insurance. One is maternity. Another was the behavioral health for the patients who need that because of the opioid problems. There were pediatric care. So the insurance company will have the option of including it or not.
Something else I think our viewers should be aware of. Many of our parents who don't have any money, and some who worked all their lives and took care of their children and raised them, and they got all the money ran out. They're in nursing homes,
Right.
and that is being paid for by Medicaid.
Excellent point.
You get rid of Medicaid as,
Or reduce it.
or reduce it as the Senate plan is. What happens with them? Do they live on the streets?
Or
That's
you
a
have to
good
sell your
question.
house.
Hopefully they won't live on the street, but they're going to have a financial bind because it's clear that there's going to be, what's proposed are cuts in Medicaid. And that just ramifies into all of society. Opioid, elderly, children, pregnancy.
Yes, it has a rippling effect
It's a
throughout
rippling
society.
effect.
You know, this is 1/6 of our economy. You know, you cannot go ahead and start talking about changing that around without a strategy that addresses in the short term and the long term the healthcare needs of people.
70 million people are on Medicaid.
Our governor decided that he didn't want to see Medicaid
Expansion. Right.
and now he wants to be your next U.S. Senator.
So we're here.
And this past week he went to Washington to help advise them on the bill that they're preparing.
And to make sure that we didn't get, in Florida, less Medicaid funding.
And to make sure we didn't get less Medicaid.
Right.
The Medicaid funding that he's already resisted,
The Medicaid funding that we have now, no less.
Right.
oh,
Yeah. Because the expansion didn't take place in Florida.
Right.
The money that is already there, they have used, and that is the reason why you have some of these small rural counties have had problems as far as their hospitals are concerned. Because he was begging Obama for more money to be able to use different monies from different pots to be able to go ahead and address that particular need.
But not the expansion.
Not the expansion, no. Now I'm talking about something else altogether different.
he always is begging for something else. You know, as a little boy, my granddaddy told me, remember, when you become a man. Buy what you need and beg for what you want.
Right.
Now, but Scott had us all confused. He wants poor people to beg for what they need, and they can't buy what they need because they don't have any money. So you have absolutely nothing. I want to talk about this fake news for a minute. You know, I'd be remiss if I didn't. The President Trump says everything is fake news.
Right.
In his press conference, he tells the people don't even talk to certain people. Don't let CNN ask questions.
Right.
Well, we find out, talking about fake, in his golf courses and his country clubs,
Right.
he has a fake large picture of him on the Time magazine cover.
No.
Oh yeah. Now Time magazine has told him to take it down. He was never Time magazine's Man of the Year.
Right.
And I don't think he ever will be. However, but he said, so anyway, in this last minute we have, you can see these notes meant nothing. But we talked about what was real.
Right.
I'll give each one of you 30 seconds to wrap it up. Dr. Hill, you go first.
Two things. One, remind your viewers about the opening of the Sarasota Memorial Hospital internal medicine practice at Newtown, which is going to be on Wednesday, July the 5th at 1 o'clock with the ribbon cutting at 1:15.
And that's at the corner of Osprey and MLK.
Can't miss it. Diagonally across the street from Jets. You're right. The other thing is that this bill is called the Better Care Reconciliation Act. That's a misnomer. This is not an act that is going to lead to better care. And we need to either vote it down or get rid of it or make it better.
And just remember that Trump, instead of Trump care, Trump don't care.
Right. It's clear.
Dr. Hill?
Well, in terms of what I would like to just convey to your viewers is the fact that there's a correlation between voting and the services that they receive as far as government is concerned. And because of that, we need to be more cognizant of the fact that we come out and vote. Dean Heller only changed his mind because he has a candidate, Jackie Rosen, who's running against him and may take his seat in 2018. So we have an opportunity to change things around when we come out to vote.
You know, I'd like to thank both of you for coming and sharing with the viewers. And listen, you heard it here. And as always, have a great day, Suncoast.
I go to the movie and I go downtown. I keep hearing them say, boy.
This is important news for men who have taken Viagra, Cialis, or Levitra and then suffered from the skin cancer melanoma. According to a new study, the use of Viagra and other ED drugs may increase the risk of men developing a serious form of skin cancer known as melanoma. Melanoma is a deadly form of skin cancer, which may require treatments such as surgery, chemotherapy, or radiation. In many advanced cases, melanoma can result in death. If you or a loved one took Viagra, Cialis, or Levitra and then were diagnosed with a skin cancer called melanoma, you may have a right to a cash award and medical expenses. Call the law offices of Davis & Crump at the number below right now to find out if you are eligible. Call the law offices of Davis & Crump right now. Our first consultation is free, and we don't get paid unless you get paid. Call now. Operators are standing by.
The official Suncoast Storm team at ABC 7. We're here for you.